So can tattoos actually cause lymphedema? Let's see what the evidence actually says. Hi, I'm Dr. Joshua Trock, Doctor of Physical Therapy, and I'm board certified in wound and lymphatic medicine, and I'm also certified in vascular physical therapy. And recently I was posed a very interesting question. Does getting a tattoo actually cause lymphedema? See, it's pretty interesting because when you're getting a tattoo, it's a lot more than just putting ink on you. It's actually putting ink inside of your skin. It's a massive question, both in the body art community as well as the vascular medicine world, especially for individuals who already are managing a compromised lymphatic system. If you look online, you'll find myths on both ends. Some people claim that tattoo needles completely destroy your body's drainage system, your lymphatic system, while others tell you it's 100% harmless. As a doctor of physical therapy specializing in the lymphatic system, I wanted to find exactly where there could possibly be an issue, where viral internet claims meet peer-reviewed reality. Today, we are diving deep into the actual science of what happens underneath the skin when you get inked. We will look at how tattoo ink is absorbed into the body and where it's placed, how it can potentially migrate, a lot of people don't think about that, directly into your lymph nodes, and whether the needle can permanently break your capillaries or your circulation underneath the skin. The truth is much more nuanced than a simple yes or no. And if you have lymphedema or are at risk for it, what we're covering today is critical knowledge before you sit in the artist's chair. To understand this, we have to look at the anatomy of a tattoo. What is actually happening? When an artist injects ink, the needle just doesn't rest on the top layer of the skin. You see, it punctures repeatedly past the epidermis and straight into the dermis. Why the dermis? Because your outer layer of the skin, the epidermis, sheds on a constant basis. Your skin basically regenerates every 4 to 6 weeks. And so if the ink stayed there, well, your investment would be gone relatively quickly. So the dermis is where the permanent tissue lies. But guess what else lives inside the dermis? It's your superficial dermal lymphatic capillary system. And this is important because this network is at the local neighborhood gutter, the filtering system, if you will, of your immune and circulatory system, which pulls away waste and fluid and protein and bacteria and viruses out of the skin so it can be filtered and killed. The tattooing process inherently and inevitably disrupts this capillary network. Your body views the tattoo pigment as a massive foreign invader. Immediately, your immune system triggers a response. First is a thing called neutrophils, which basically neutralize the bad guys, and then you have the big boys roll in, and those are called macrophages. And that's the cleanup initially of your immune system. It rushes to the site, swallows up the ink particles, and tries to clear them out. And where do they clear them to? Well, a lot of it ends up in your lymphatic system. See, the scientific evidence on pigment migration is profound. There's a special type of imaging called Synchrotron, which images human cadaveric tissue or bodies. It's proven that there's a simultaneous transport of organic pigments, heavy metals, and titanium dioxide directly from your tattooed skin straight into your lymphatic nodes. And the smallest particles preferentially travel first. In fact, clinical estimates show that roughly 32% of injected tattoo pigment is cleared out and translocated or moved from the skin within the first 6 weeks. Over a lifetime, that number can skyrocket to as much as 99%. Your lymphatic system is actively absorbing and storing your tattoo ink. So if your lymphatics absorb the ink, does that mean they are damaged? So we're going to break this down into 2 parts. So first, the lymph nodes, and then the cutaneous capillary. So first, the nodes. When tattoo pigment arrives at the regional lymph nodes, it doesn't just pass through, it stays there. This can cause macroscopically visible pigment deposits, meaning if a surgeon looked at the lymph nodes draining a heavily tattooed arm, those lymph nodes would literally be stained the color of the tattoo ink. In animal studies, researchers tracked what happens inside of those draining lymph nodes after ink exposure. They discovered that tattoo ink induces persistent chronic inflammation in the draining node that lasts for at least 2 months after the tattooing process. The macrophages capture the ink, but the overwhelming presence of these heavy metals and pigments can induce cellular apoptosis or death, which is programmed in both humans and cell models. See, what happens in terms of the macrophages is there's two types. There's M1 and M2. M1 macrophages are what's helping manage the problem. You see, there's a foreign invader, we got to get rid of all this stuff, and once that's done, the M2 macrophages come in and rebuild. But if there's a constant persistent damage, well, then we're going to stay in that inflammatory state. So despite this microscopic cell death and structural staining for a healthy individual, this chronic inflammation and pigment loading does not automatically cause the lymph node to shut down or fail. The lymph node is incredibly resilient. It accommodates the ink and adjusts and continuously filters the fluid. So the absorption itself does not necessarily mean systemic failure, which is what we would see in a true lymphedema or lymphatic failure. However, the real risk isn't necessarily inside the deep lymph nodes, it's right at the surface. In those tiny cutaneous lymph capillaries we talked about earlier, these are finger-like projections that passively absorb the fluid. While the systemic lymphatic system is generally strong enough to handle ink transport, the intense mechanical trauma of thousands of needle punctures can absolutely overwhelm, scar, or damage those local cutaneous capillaries. Think of it like a local road construction. A single pothole won't stop the traffic across the city, but if you tear up every street in a 2-mile radius, local transport grinds to a halt. When you get a massive tattoo like a full sleeve or dense, highly saturated chest piece, the sheer volume of localized trauma can cause micro scarring across those delicate surface drainage pathways. For someone with a perfectly healthy, high-functioning vascular system, their body has enough lymphatic margin to reroute the fluid. The superficial damage won't trigger full-blown swelling because nearby deeper pathways pick up the extra slack. But what if your lymphatic system is already compromised? This brings us to the ultimate clinical verdict. If you have been diagnosed with lymphedema, or maybe you have a venous disease that's causing a lymphedema in your legs, or if you've had lymph nodes removed or radiated due to breast cancer or other treatments, pelvic cancer, something like that, your lymphatic safety margin is already gone. If you had a really high capacity, a really low load in terms of fluid, if you segmentally started to reduce them, there could be a problem. You see, in a compromised limb, your lymphatics are already operating at a maximum capacity, trying to prevent the buildup of swelling. Tearing through those delicate cutaneous capillaries with a tattoo needle, forcing the local tissue to clear a massive load of toxic heavy metals, inducing 2 months of persistent lymph node inflammation is a recipe for disaster. It can easily push a latent non-swollen lymph straight into maybe a stage 1 or even a stage 2 lymphedema, theoretically, or trigger a severe localized infection like cellulitis, which would further destroy your vessels every time that happens. So do tattoos cause lymphedema? In a healthy individual, the ink migrates safely. And though it alters the nodes and causes superficial capillary stress, it rarely causes structural failure. But in a compromised individual, that localized stress can be the exact trigger that breaks the system. This is why with someone who has lymphedema from breast cancer, potentially lymphedema, we don't do blood draws, we don't take blood pressures in that affected arm for that very specific reason. If you're dealing with swelling or want to keep your circulatory system healthy and optimized, remember that non-invasive therapies can play a huge role in supporting your lymphatic flow. Complete decongestive therapy, which is compression therapy, which is manual lymphatic drainage, which is rhythmic exercise, pool therapy, hydrotherapy, skin care, healthy diet that is low inflammatory. All those things are incredibly helpful. So simple habits like these act as a powerful full body compression dosage that accelerates fluid clearance and keeps your pathways open. If this breakdown helped you understand the mechanics of your skin and lymphatics a little bit better, hit the like button, drop a comment, and with your thoughts or questions about tattoos or anything else about the lymphatic system or vascular system you'd like to know. Make sure to subscribe to the channel. I'm Dr. Josh Wotrock, Doctor of Physical Therapy and Lymphatic Expert, and I will see you in the next video.